Hello, listeners. Welcome to Views on Health. A great pleasure, as always, to have on the program Dr. Melanie Amarasooriya, consultant orthopedic surgeon and senior lecturer, Faculty of Medicine, University of Moratuwa. Dr. Melanie Amarasooriya is going to focus on hand injuries. Over to you, doctor.
Thank you, Fatima. So I thought it's important to talk about hand injuries for few reasons. One thing is it's very, very common, and also when you have an injury to your hands, it can be very debilitating as well. So it affects all your activities of daily living. And the third important reason, that something we don't quite think about, is the rehabilitation in hand injuries is really important, even probably more than other joints or structures in the body. So that's why I chose this topic today to talk about hand injuries.
Thank you. So that's interesting. Yes, I can imagine if anyone, even us, even just sometimes a cut on a finger can make it difficult to do basic chores in the house or for yourself. So I can understand it's an injury per se of the hand, how difficult it could be. So over to you, doctor, to tell our listeners how common it is, in the sense that which part of the hand is more common, or it could be the whole arm, maybe the wrist, the fingers, the elbow, forearm.
Yes, thank you. So I thought I'd focus today mainly on the actual hand that is below the wrist, so which involves a part of the fingers, the thumb and the palm, and the dorsal aspect of the back of the hand. How common it is actually? How common is it actually? So it's one of the most common causes to present to an emergency department. So if you take the numbers, more than 1/5 of presentations to a surgical emergency department is due to hand injuries, hand and wrist injuries mainly. And if you take the Western statistics, it's probably one of the most important issues in terms of cost, healthcare cost and productivity costs, and even more than the hip and knee problems. So hand injuries are very costly to the healthcare system as well as for the patients, because you can't go to work, you can't do much when your hands are injured. Our common causes are, it can be industry related. So you can get hand injuries at your workplace. Say if you're a laborer lifting things up, or if you're operating heavy machinery, and if you don't adhere to safety precautions, yes, hand injuries can happen in those situations. So these are industrial ones. And then domestic accidents are another common cause. So those are like cut injuries and accidental injuries that can happen in the household. And then assaults also are an important cause. In our setting, we do see quite a lot of patients after being assaulted. And self-inflicted cut injuries are also common among young people, so which is quite sad. And then like fractures just after falls and all that, so as in any other injury. So those are the common causes of hand injuries. So when your hand is injured, there are several structures that can get affected. If you fall onto your hand, yes, you can have fractured bones. If you take an X-ray, your doctor will tell, okay, there's a fracture in a bone of your thumb or your little finger. But then, more than that, there are few things that are important in the hand, like tendons. So a tendon is a structure that connects a muscle to the bone. So it's like a rope. So when the muscle contracts and pulls the tendon acts like a rope moving your bone. It's pretty much like operating string puppets. So when you pull a string, the puppet can bend an arm. So similarly, when the tendon gets pulled by the muscle, we can bend our fingers, we can grip something. So tendons are actually really important. So when you cut your hand, say it's a glass cut injury, or you accidentally cut it when you're chopping vegetables. So if a tendon is cut, you will see that you can't really operate your hand the way you used to do. You can't bend your fingers. and the finger remains straight. And if there's a cut in the back of the hand, you might feel that you can't straighten the finger, it sort of drops. So those are the other important things that we have to look at when you have a cut injury in the hand. And then lastly, the nerves of the hand are super important. Nerves are the structures that give sensation to your hand and help you move your hand. So it sort of controls your hand. So imagine if you don't have the sensation of the hand, you don't know what you're holding or what you're touching, and you can't feel if you're touching a hot surface. So nerves are really important, and they're tiny structures. And if you have a cut injury, nerves could get damaged, and then you might lose the sensation of a finger or several fingers. So those are the sinister things to look when a hand is injured. So it's bones, tendons, nerves, in addition to the skin.
So it's sort of a thing that for us seems very, very traumatic. And when you take on such a patient, it must be a very delicate process to deal with this such injuries, doctor. It's not a big thing that you can just put it together, but it will go very gently from point to point.
Correct.
Am I right?
Yes, absolutely. I think that's a really important aspect when you're dealing with hand injuries. So as orthopedic surgeons, yes, we deal with hips and knees, which are pretty large bones and large joints. So you need a lot of muscle power. But when it comes to hands, you have to be really delicate. Number one, to identify which structures have been cut. So we have to pay real attention to examine you. Okay, so this is a tiny cut, but which layers are affected? Is it just the skin? Is your tendon injured? Is your nerves injured? So we have to check for each little thing. And then when you're going to put it back together, so a tendon actually is like, I would say, a few millimeters wide, so like 5-6 millimeters, and a nerve is like 2 millimeters wide maybe in the hand. So you have to use magnification. So we use a surgical thing called surgical loops, where we have magnifying glasses attached to a glass frame, like you're wearing spectacles with a magnifying ability. And then we enlarge we see it about 3 to 4 times enlarged. So then we can pay attention to those injured structures and put them back together. And again, using stitches also, they're very fine stitches. So if you have used the stitches that we use for skin, the stitches that we use for nerves are very, very tiny. Sometimes you can't really see with your naked eyes. And then if it's a really bad nerve injury, we use an operating microscope. So that's a very large microscope, so that can increase has a magnifying power up to about like 10-12 sometimes. So it is a delicate thing to operate on hands. Yes.
So you obviously need such technical assistance, I would say, when you have such equipment to help you to put things right.
Correct. So technically, I would say it's very demanding. You have to undergo so many years of training to have that dexterity to put a nerve back together, and your surgical assistant has to be equipped with the same skill set, and you should have appropriate instruments that can handle these like tiny nerves, like extremely small tiny suture material, and you should be able to stitch them with so much of precision. Otherwise it's really difficult to get a good outcome with hands.
So are such procedures done under local anesthesia or general anesthesia?
Brilliant question. I love that question. Yes, like years ago it was done under general anesthesia because they take time, and also it can be painful to the patients, and the patients are anxious, and most importantly, we want a bloodless field. So to create a bloodless field in your hand, we need to stop blood going into your hand for, say, a couple of hours. So we can use a tourniquet, which is pretty much like a blood pressure cuff. So we inflate that blood pressure cuff in your arm, so it stops blood going into the hand, so we can really see. Now things have changed, which is a very good thing. We can do this under local anesthesia without a tourniquet. So in Canada, actually, there's a surgeon called Don Lolland who's popularized this technique called wide awake surgical techniques done under local anesthesia without a tourniquet. So most of the hand injuries, I think almost everything, including fracture fixation, including nerve repairs, tendon repairs, multiple injuries, are done under this technique of local anesthesia, no tourniquet, and you go home pretty much after the procedure. I mean, which is very cost effective for the hospital system, and also it's convenient for the patients.
Doctor, I have a concern there. You say convenient for the patient, but can the patient take all of this? Mentally, I'm saying, knowing that this is going on, and obviously he or she won't feel any pain because you have anesthetized that area. But beyond that, can a patient just be motionless because you can't have the patient moving around when they're doing this? How do you handle that?
Well, good question again. How practical is this? Although
exactly.
Yeah, so you would be surprised if I tell you that the youngest child that I've operated under this technique and done a tendon repair was 6 years. Okay, so what you need is you need to explain to the patient really well what you're going to do. So then they understand, and then you're sort of giving the pros and cons to the patients. Okay, we can put you to sleep, but you need to be fasting for 6 hours, and the risks of general anesthesia are these. Although it's very safe, local anesthesia is safer. So you don't need fasting, and then immediately after the procedure you can go home. You can use your earphones and listen to music while we do this. And if you want to talk to us during the procedure, you can. And pretty much most of the patients like this. And the moment you win their confidence, they keep talking to you while you're operating. And the most important aspect of this technique is that you can get them to move the hand and check the integrity of your repair. And you can show the patient, all right, I've stitched up your hand. This is how it looks like. You need to move this from next day to get a good function. So they develop this confidence. So my hand's pain-free. It's all being stitched up. I can move it. And then these cohort of patients rehabilitate really well because they are actually part of the procedure now. So when you talk to the patient, you can do this patient in almost anyone, including children. But I can understand in cultures like ours, sometimes certain patients can be anxious. Then you have to sort of resort to general anesthesia if the patient is really not cooperating.
Thank you, doctor, because I'm just wondering how, you spoke of children, and if children are, I would say, confident that I'm going to be okay, the doctor has told me what's going to happen, and I don't think I need to be afraid. I think it really augurs well. So procedure, of course, the time frame can vary, obviously, according to the trauma. So even it's a local anesthesia, will it last for a long period of time? Or in such situations, would you then go for a general anesthesia?
Yeah, again,
if it's like a longer surgery? Yeah,
good question. So there are limitations for local anesthesia. So if the surgery is going to last like 3-4 hours, of course, it's going to be difficult. So that is a sort of a time point where we would think about, okay, we need general anesthesia for this case. And as you said, if it's like every single tendon in the hand is involved and we need like the patient on table for 3 hours, then of course the patient can move, and it can be a bit tricky to do this surgery with such precision. So for longer surgeries, of course, we weigh everything on a case-by-case basis, talk to the patient and proceed. Yeah.
And you said that they can obviously go home the same day. How is that possible, doctor? I mean, you will obviously put a dressing on the injury, all of that, but you think it's, I mean, you're doing it, but just tell us how safe is it?
Yeah, again, thank you for that question. So we repair all the structures that's damaged and stitch the skin up, and we put a waterproof dressing usually. I mean, unless it's not available in certain hospital, of course we can't. But most of the time we use a waterproof dressing. So anyway, you have a big dressing in your hand, and then we give adequate, long-lasting local anesthetic injection so that your hand is pain-free for like 8 hours or so. So when you go home, your hand is actually pain-free, and we don't cover your entire hand, we just cover the wounds. So anything that's been stitched up is covered, but we try to keep whatever that can be left open, so you can use your hand. So the whole objective of doing a hand surgery and putting this back together is to get you use your hand immediately next day. So to do that, you have to be pain-free, and you have to have certain areas of the hand exposed. So we try to adhere to those two principles pretty much. So taking your painkillers is really important. So in addition to the local anesthetic, we will give you prescribed painkillers. Some patients do think, okay, I don't have much pain, I don't need to take it. But then it's really important you take your painkillers before you get the pain. So you prevent it coming back and stopping you do things. What we want is you going back to your normal life. Having said that, make sure that you don't wet that dressing, because if it gets wet and if it's a wet dressing, then your chances of infection is high. So protect the area that's been operated, but use your hand to pretty much do everything that you can. So painkillers are helpful, covering or dressing will be helpful. Yeah.
For how long do you prescribe painkillers, or like how many doses? For maybe 2 days, 3 days, or it depends on the injury?
It depends on the injury. So I normally personally give them painkillers at least for about a week, because I want them moving their fingers. And then I usually get them to see us in about a week's time. And then if it's still painful, we can prescribe more painkillers. Sometimes nerve injuries can be a bit tricky. They might need painkillers longer than that. So always we are very generous with painkillers. The whole purpose is prevent the pain, get you use the hand.
Yeah, because if you're pain-free, you can have peace of mind as well.
Correct, that's the other important thing. Because hand is very particular. If you don't use it, it becomes very stiff. So, and it's really difficult to get rid of this stiffness. So some patients who's had surgeries in the wrist, I see them, they haven't used their hand. So when they come after about 6 weeks, their fingers are stiff, their shoulders stiff, their elbows stiff. So to prevent that, moving is really important with regard to the hand. For example, we tell the patients, okay, you've had an operation in your wrist, it's covered, but use your hand to comb your hair. If you can brush your teeth, do it. So you're moving your shoulder, you're moving your elbow, and you're moving your fingers. So I think as a take-home message, it's really important. Talk to your doctor and ask what you can't do, and then keep moving your fingers as much as possible.
So what can't they do in certain situations?
Yeah, so if you have had a tendon repair, so tendons are the rope-like structures I've explained earlier. So if you had a tendon repair, we don't want you pulling the repair the other way, like we don't want any tension on that tendon. So if you had a tendon repair on the palm aspect, on the palm side of your hand, we might sometimes put a splint or a brace so that you can't fully straighten your fingers. So if we repair a tendon on the palm side of the hand, you will notice we maintain your hand in slight flexion or slight bent position. That is to reduce the tension on that repair until it heals. So you can't overstretch that repair, because then it can fail. So those are the things that you can't do. Other than that, don't get the dressing wet. and all the other instructions vary depending on the cases. So tendon repairs are pretty particular with regard to their post-operative instructions.
Thank you, doctor. So there are, I know, every situation, every patient, whatever the ailment, is a case-by-case basis. So we have to accept that, and your treatment will go according to that. Now, once they recover, everything comes back to normal. So there is a process for recovery. You prescribe painkillers, you prescribe exercising the limb, that part of it, and otherwise if the tendon, you say don't, you take precautions by placing even a brace so that you allow the healing process without aggravating it. All these are factors that you have put in place. Now, can if by any chance there is the injury recurs for some reason, sometimes unforeseen, what you do then? I mean, obviously they come back to you in pain and with whatever the problem they have. How do you deal with that, doctor?
Yeah, it's actually a tricky situation. It's unfortunate.
It has happened?
Yeah, it happens. Like, any surgery has complications. So one of the complication is like failure. I mean, the complications are very minimal, but then it can happen. Like, for example, you can put a tendon back together, but maybe you would have fallen again, or you reached out to get something and you accidentally stretched it, and then the repair gapes and you come back. Those situations can happen. Unfortunately, then you have to, you're back at square one and we stop the procedure again. But then one thing that I want to highlight is the time for recovery. So that's the important lesson there. I mean, if you had a complications, yes, we are experienced enough to deal with it. That happens all around the world and we know about it and we are sort of ready to deal with it. But then the most important thing there is, how do you prevent these complications from happening? What you need to realize is each tissue takes its own time to heal. For example, a cut in the skin, just a skin cut, would heal in about 7 to 14 days, like 1 to 2 weeks, you're good. You can't do anything. But if you have damaged a nerve, the nerve repair, it takes time to give you the sensation back. So nerve needs to grow from that cut point even after a repair. It grows at a rate of 1 millimeter a day. So if it's like in your index finger, at the base of your index finger, for you to get some sensation at the tip, it's about 7 centimeters, so it'll take about 70 days. So you have to know that this is going to be a long process, and wait and follow the instructions. Tendons, again, by about 6 weeks, they're pretty strong, but then takes about 3 months for full rehabilitation and everything. So that's really important. And the other side is, if you're too scared that this might give way and don't do your exercises that we recommend, then there's stiffness. So it's a very delicate balance between protecting these structures versus getting them to mobilize adequately and not too much. So that's why we would always see these hand injury patients every week or so, and gradually we'll sort of tell you, okay, at this week you can do this, and then at week 2 you can proceed to the next level. So you need usually close follow-up.
So I think what the bottom line is that medical advice has got to be taken seriously and followed, adhered to in this situation.
Correct. You need to be closely followed up, and we'll give you instructions every week, and then you need to come for those visits and do what you're advised to do.
One final question, doctor, which could have been asked earlier, but I kept it for the end. If a person undergoes such trauma, some sort of injury with the hand, how far should he or she seek treatment? Because they can sometimes think, no, I think I'll do this at home, it'll settle by itself, but may not. So what would you advise?
Yeah.
Assuming they can know that this is not a simple thing. It's not just a cut that they can, put a plaster and let it heal.
Yeah. So if you have an industrial accident, immediately go to the closest hospital. Like if it's an accident at workplace, immediately go to the hospital. If it's a farmyard injury, which can be contaminated, go to the hospital immediately. Glass cut injuries and ceramic cut injuries are also very nasty. You might see a tiny wound on the surface, but there can be damage deeper. So if it's an injury in the hand, I have a very low threshold to seek medical advice, unless it's a really like a simple cut when you're chopping vegetables or something. So earlier, if you seek treatment earlier, your outcome will be always better. So we can examine and treat that. But as a general guideline, if it's just a cut, but if you can't move your hand, if you can't move your fingers, if they're not bending and straightening as normal, or if you have some numbness, I would be concerned that it is an injury that's involving something more than the skin. So I would definitely seek medical treatment at that point.
Thank you, Doctor. And on that note of advice, we end this very interesting discussion on hand injury. To you, Dr. Melanie Amarasooriya, consultant orthopedic surgeon and senior lecturer at the Faculty of Medicine, University of Moratuwa, we say thank you. Thank you so much.
Thank you so much, Fatima.
It's been a pleasure. And thank you too to Damayanti Kolambage for technical assistance. I'm Fatima Razikade saying good night and hoping to catch you next Monday same time on Views on Health.